somebody's laying on the interstate and they're writhing in pain and they're bleeding. So you're going to come and do our ABCs. So first you're going to alert. You're going to make sure the scene is safe, there's no cars, there's no gas, you call 911. Okay, now you come in and you find the source of bleeding, Diane.
Okay.
So it's right here underneath the pant legs. So you're going to rip the pant legs apart and then you're going to pack the wound. So we're going to take this gauze and you're going to push it in there. It's like stuffing as much as you can push in there. And you continue to push until you can't push anymore, all the way down. And you can hold it out. And then when you would get that all the way full to where you couldn't put another piece in, you hold pressure over that and you're not going to let go until help comes from a higher level of care. Paramedics, the flight crew, or you might hold it all the way in until you get to Mercy emergency room and have a trauma surgeon see it. And the thing that's nice about these tourniquets is you can put them on yourself. So when you're in a situation where there's more than one person, you could save yourself first so you can help others. So I've seen that there's a big laceration with pulsatile bleeding in his lower arm right here. So I'm going to put the tourniquet on, and it's not going to be over bones or a joint. And then I'm going to pull this tourniquet as tight as I possibly can, and I don't see any more bleeding here, and there isn't a pulse here. But there's absolutely no bleeding, so I'm going to pull it a little bit more, and then I'm going to take this windlass, and I'm going to turn it probably just once is all I'll have to do, because it will be tight enough. And then I'm going to put it in the clip here, which holds it.
Keeps it from unwinding.
Yep, it won't go anywhere. And then we'll simply put the time here. The tourniquet, the rest of it I'll just put around so it's out of the way. This tourniquet stays on and doesn't get released or taken off until a physician does that. If I see any bleeding, I can take a second tourniquet and put above the first one, and then I would make sure that the bleeding is stopped. But again, the tourniquet does not come off until a physician takes it off.